Joining me now is Ian Culbert. He is the Executive Director of the Canadian Public Health Association. Thanks very much for joining us.
My pleasure.
Let's walk through this. I mean, I guess, first of all, just your general reactions to what we saw today.
We're really very pleased because we do believe that the federal government is taking a public health approach to the legalization and regulation of edible products that have a cannabis basis to them. And that's really important because there's obviously a demand for these products. They need to be manufactured in a safe way. We need to know how potent the products are. But most importantly, the consumer needs to educate themselves about using these products.
Okay. Why the delay? Because a lot of Canadians, I mean, who didn't follow the debate were unaware why it was going to take a little extra time to deal with, regulate, and control the edibles and ointments and extracts.
Well, the legalization and regulation of cannabis in Canada is a massive change in policy. They estimated that there were somewhere near to 16,000 decision points just for the legalization of the dried substance. And then when you add edibles to that, the levels of complexity just magnify. So they just needed extra time to be able to get it right. And it's certainly one of the lessons that we learned from other jurisdictions. If you try to do too much too fast, you end up making hasty regulation that really doesn't satisfy the requirements.
Okay, I want to get to, I mean, one of the interesting things is that in the new regulations, they divide this whole field into three different categories: edibles, cannabis extracts, and cannabis topicals. So topicals would be like ointments or oils.
Right.
What are the three categories and why would they be divided up into three like that?
Well, it really comes down to how they're going to be used. And so you need to know your potency differently depending on how you're using it. An ointment, for example, a topical, can be absorbed very quickly into your system and can be probably one of the more potent ways of consuming it. An edible, you're going to digest, and then it's taken through your digestive system, so its effect takes much longer to feel, but can last much longer. So they are very different topics, even though THC is the underlying component in all of them.
And extracts in all of this, what would the extracts be? That would be like...
Extracts are specific oils that you can then be using to make your own products with.
What were your concerns, for example? I mean, there have been concerns expressed, for example, people referred to Colorado, and there was big problems that they encountered with their legalization of edibles. What were the concerns, and do you think we're going to be avoiding them?
We have learned a lot of the lessons from jurisdictions such as Colorado. Certainly the number one problem there was the entire legalization process was driven by the industry. And in Canada, public safety has been involved, health has been involved, public health has been involved in really driving it from a very different perspective. But we've also learned the lessons of you need to be more restrictive in the beginning, and perhaps people will say, well, there's too many rules and you're not allowing us enough flexibility. We will learn that over time, and if it makes sense to loosen regulations, it's much easier to do that than to tighten regulations.
One of the things that I saw in the regulations is that they're not going to allow products that mix alcohol and cannabis, and they're not going to allow products that mix tobacco and cannabis. Why not?
Well, certainly we don't want anyone using tobacco. It is a cancer-causing substance. It is one of the leading causes of death in this country. We do not want you mixing tobacco with cannabis ever. We don't want you mixing alcohol with THC because the effect on the human body is unpredictable and it's very specific. You're actually combining two substances that shouldn't be going together. So even if they're not allowed in a substance, an important message to consumers is never consume them at the same time if separate. So we've seen situations of people out for the evening in a nightclub consuming alcohol, and then they have an edible, and the results can be quite devastating.
Okay. The Canadian Public Health Association, you were in favor of legalization on a public health basis. One of the arguments was if we make it legal, we can control it, and we can, et cetera, et cetera. As you know, though, one of the key things was getting the legal market surpassing the illicit market. There's been a lot of reports in the last 8 months. I mean, you can argue it's still early, but there's been a lot of reports that in provinces like Ontario and others, they haven't even made a dent in the the production and the legal sales haven't really met the demand. So if your goal is to replace the illicit market, we're not doing very well. Is there a concern in bringing in this $2.7 billion new industry that a lot of the production will just go to that area and we still won't be making a big enough dent in replacing the illegal product?
Well, from our perspective, we were never expecting the legal market to overtake the illegal market in the short term.
Overnight.
We're talking about 5 to 10 years before you really see the illegal market being overshadowed by the legal market. That was our expectation, because we're creating a brand new legal industry. And so it takes time. And so I would say in Canada, we've done quite well. For people who have been regular users of cannabis products and they have their guy that they get their product from, right now there's not a lot of incentive for them to move away from that supplier.
Cost and availability are both cited as big problems. There's provinces where the cost is nowhere near, it's much more expensive than your guy, as you put it.
Exactly. And over time, I think we're going to see closer to parity between the illegal and legal markets as the legal market just catches up. It's the rate of growth is astronomical in this industry. And with any fast-growing industry, it takes time to work all of the kinks out and to get your economies of scale working. So I'm not displeased with the progress that we've made because I know that it will take a significant amount of time.
Your biggest concern, is it children consuming the product? Because one of the other jurisdictions, I mentioned Colorado and places like that, when you have candy products with THC and other substances in it, and it's how do these regulations address that concern about not making this very attractive to children?
Well, in addition to not mixing these products with tobacco or alcohol, you can't have additives such as caffeine or sugar or colorants, and they can't be shaped in such a way that they're going to be attractive to children. So important lessons learned from Colorado. We're not going to have quote-unquote gummy bears infused with THC. That's really important. The most important thing is for consumers is if you have an edible product in your house or a topical or an oil, you need to lock that up if you have small children in the house because they cannot tell the difference. And it seems strange. We tell people lock up your liquor cabinet. You should be locking up your cannabis as well. Is
that just more a question of public education? I mean, regulation is not going to cover that.
No, it won't. It is education. And getting that message out there that this is a serious product that we're talking about. It can do harm to children. We're talking about a poisoning, not death, but a serious poisoning that we want to avoid. But that goes for adults too. If you have not consumed these products and consumed them as an edible, you need to educate yourself. Start slow and go slow.
I'll ask you a big question, but it could maybe have just an easy answer. It was 8 months ago that the legalization came about. There was so much media attention. There was so much public attention to that October 17th deadline. We're now 8 months in, and we're now going to, on the year anniversary, have edibles. How does the Canadian Public Health Agency or organization, how do you evaluate how we've dealt with this as a country?
Evaluation is a big part of what the work that still needs to be done. We had a national forum in Ottawa just a month and a half ago that talked about that. The early results are that we're doing fairly well. It's been, as I say, a massive policy change in this country with potentially over 16,000 decision points at different levels of government. Still lots of work to be done, but it was an important step. You could delay and delay until you have every decision made, but quite honestly, the environment keeps changing, and so you have to adjust as you go. So I would say so far, we're doing well. We just have to remain vigilant and continue to do that evaluation.
Okay, well, I want to thank you very much for coming in, and we will no doubt be having other interviews on this as we monitor this as it rolls out. Thank you very much.
My pleasure.